This is Health Dose, a podcast from My Michigan Health focusing on different issues related to your health. Evidence shows that 2/3 of individuals living with Alzheimer's disease are women, and that changes in the brain occur 2 decades before Alzheimer's disease symptoms develop. Joining us today to discuss Alzheimer's disease in the female population is primary care physician Elisabeth Milligan, MD. And so, Dr. Milligan, let's simply start today by asking, what is Alzheimer's disease and what causes it?
Yeah, great question. Alzheimer's disease is a neurodegenerative disease. It shows up as a decline in someone's memory and their ability to process information, and can also show up as changes in their behavior. The exact mechanism of what causes dementia is still being actively researched. There's not one singular thing that leads to it, but several genetic and lifestyle factors that we know seem to intermingle and eventually lead to the development of the disease.
So you mentioned dementia there. What are the two differences, or what are some of the primary differences between Alzheimer's and dementia?
Yeah, so Alzheimer's is one type of dementia. It is the most common type, makes up 60 to 80% of cases of dementia. Some of the other forms include vascular dementia and Parkinson's dementia.
And so today we're specifically talking about women and Alzheimer's disease. And so what risks in particular impact women when it comes to Alzheimer's?
Yeah, high blood pressure, high cholesterol. Cerebrovascular disease is a big one, so that more commonly known as strokes, which are very important as a risk factor for women because strokes are more common in women than they are in men. Type 2 diabetes, obesity, physical inactivity, all of these things are risk factors and impact women.
She's Dr. Milligan, joining us from My Michigan Health to discuss women and Alzheimer's disease today. We've now touched on some of the risks in particular that impact women with Alzheimer's. Does it present itself differently than it does in men, this disease, Alzheimer's and dementia, or does it look the same?
Yeah, it can look very different for different people, not entirely related to their gender, but just their personality. So based on what they do, their activities, some will have trouble with multi-step tasks, things like organizing meals, planning those things. Activities that take multiple levels to coordinate. Other people, it will show up more as a mood dominant presentation. So they're all of a sudden very anxious in ways that they weren't, or can show up as depression as well. And then that can be tricky to diagnose because they'll often just withdraw from others and really withdraw from their social circles, and difficult to realize that that's really the underlying issue for them.
And so are those symptoms that you just listed the primary way for diagnosis, or are you diagnosing in other ways? Are there more, intricate ways to figure out that someone has Alzheimer's?
Yeah, those are definitely some of the first things we would ask, in a primary care office visit, changes that the person themselves or their loved one has noticed. There's also a lot of tools that we use in the office, different screening, scoring tools that can be used. Just asking questions about memory or little tests that give us an idea of what's going on. Occasionally imaging is used as well, but most of the time just screening and asking questions is enough to get us a pretty good diagnosis.
So then I'm sure a lot of families that may be listening have relatives that might be slowly progressing through Alzheimer's, and a big question has got to be, how do we slow this? How do we prevent this moving forward for our loved ones?
Absolutely. There are many things you can do. A lot of them just involve keeping your mind and your body healthy. Blood pressure is a major one, so if you have high blood pressure, keeping that under control. Same with your cholesterol. If you get your cholesterol checked, if it's high, get that under control. Stay physically active. If you do develop diabetes, keep that well controlled. If you're smoking, quit. If you haven't started, don't start. Getting sleep, I think, is something that's often overlooked. High quality sleep is crucial for every aspect of health, but particularly memory. There's also some emerging evidence for staying socially active and connected and staying engaged in activities you enjoy that exercise your mind. So whether that's working on puzzles, reading, doing new hobbies, new projects, whatever it is that keeps you excited. Those things keep your brain healthy too.
And so besides some of the, I guess, personality or behavioral things that can be done to stop the progression of Alzheimer's disease, are there any more kind of medical treatments to help with folks who have maybe progressed a little too far?
Yes, there are. Cholinesterase inhibitors are the most commonly used class of medication. That includes like donepezil. They do have some benefit in people with dementia with their memory and their cognitive function. Amantadine is another medication that has shown some improvement. There's no awesome treatments at this point, nothing that can reverse the disease. There is a lot emerging in the research currently, though. There's a lot coming out. I think in the next few years, it seems like monoclonal antibodies might be where we're headed, hopefully in the near future.
And so working in family medicine, Dr. Milligan is joining us here to discuss women and Alzheimer's disease. How does this process start for a family or someone who thinks they might have Alzheimer's coming into your office or their primary care provider's office?
Yeah, make an appointment, talk to your primary care doctor. That's definitely going to be the place to start. They know you, they know all of your other medical problems. They likely know your family as well. So that's a great launching point. We also have great other services here at My Michigan. So you may end up seeing specialists down the road or having some other intervention, but that's definitely the place to start.
Again, a special thank you to Dr. Elisabeth Milligan on this edition of Health Dose, a podcast from My Michigan Health focusing on different issues related to your health. As always, if you have health concerns, you should check in with your primary care provider. If you need help finding a primary care provider, go to mymichigan.org/doctors.